And next up is Dr. Ina Kelly, and Ina has you have a long thing here, but I'll just give a brief synopsis. Ina is a consultant in public health medicine, and she's in the HSC, the Midlands region. But I suppose importantly, Ina is the chair of the National HSC's Public Health Medicine, Environment and Health Group, and she is also on the Climate Action, at the Climate Change Advisory Council Adaptation Committee. So she has quite many interests, including in the health protection side, waterborne infectious diseases and the impacts of climate change. And that's what Ina's going to talk to us now about, which is the health risks and hazards from heat waves and air quality scenarios. Thank you, Ina.
Thank you. Okay, thank you very much for inviting me to talk here, and I was very interested in the previous presentations because they're all areas that are impacting on the health of the public in Ireland. And I think I know all of the presenters because we're all working together to try and improve the health of the people in Ireland as well. So I'm going to talk really particularly about heat waves and air pollution from a different angle maybe than from what Patrick was talking about there, and looking at the challenges that we face in trying to tackle these health risks. And there's some solutions, and I think they're probably integrated solutions really. And I suppose we need to make it easier for people to make their homes safer for sustainable and safe choices. So for the health hazards and risks from heat waves, there have been some startling examples, I think, in Europe. I mean, we hear them all, we see examples all around the world, but particularly in Europe, which is close to home, we've seen in the heat wave in 2003, there were a very large number of people who were expected to have died because of the heat wave during the summer. I think the literature indicates about 70,000 people, many of them in France. There was a lot of learning about that, where the risks were and the risk factors for that. So Europe has learned a bit about that. I'm not sure that we have in Ireland yet. Wildfires in London in 2022, I think, we saw, I think, very dramatic pictures of houses burning down, physical risk to people and stress, losses. You can imagine what it's like to have faced, to be involved in something like that as well. So it's important that we're sort of conscious of what's happening in other countries. It may not have arrived here much yet, but I think unfortunately, with climate change, we're expecting more. So I hope you can read. There's a little bit of small writing there, but the direct hazards that we see with heat waves would include, obviously outdoor temperature, but for homes it's indoor temperature, and wildfires, even though they're maybe in the distance, can obviously impact on your house and also the air quality. Indirect hazards are really, or whether call them indirect hazards, but if our homes aren't adapted to heat waves, if they're not able to keep us cool, they're a risk to us too. Healthcare facilities, if we are, if we're suffering from hypothermia and going to a hospital that is actually warmer or too warm, you can't actually cool down, so it's actually not able to provide the treatment that's required for our people. So it's really important that we're conscious of upper temperatures within buildings as well, and I think that's maybe a weakness in Ireland. We have drought can impact on our water, because I know we've had outbreaks in the past in which there was an association with using alternative supply that wasn't safe when water ran out. Vulnerable groups can be impacted, like our ageing population. I mean, the population in Ireland is ageing, though, we have all age groups can be impacted by many of these hazards. Homeless people can be impacted so severely during heat waves, and even though we're talking about homes, outdoor workers, and in Ireland we have a lot of people with skin types, especially 1 and 2, that are more vulnerable to the excessive UV exposure as well. So the risks we might get would be hyperthermia and heat stroke and excess mortality. And, exacerbations of asthma and COPD, especially if you've got wildfires. And I think during heat waves, people maybe take risks as well that they may not be realising. Obviously, get risk of skin cancer, but unsafe cooling, like drowning. We often hear of drowning events during summer when people are maybe taking risks and getting into unsafe water areas, and aggressive behaviours even associated with warm weather as well, that are very hot weather. People are inclined to become more aggressive, and there's more violence, and then there's also mental health problems as well, including increased risk of suicide. So there are many risks there. Air pollution, again, has a wide range of the hazards would be, like in indoors, outdoor air pollution impacts, as do open fires and volatile organic compounds and radon accumulation. And, it's really important that our houses are able to deal with these. Aeroallergens with climate change, we're expecting a longer pollen growing season. And then, wildfires and smog I've mentioned. Existing vulnerabilities are we have a high asthma prevalence in Ireland. I think Ireland might have the fourth highest prevalence of asthma in the world. And as David's already mentioned, it's a high radon country as well here. So we have these risks, especially respiratory risks there, and all cause mortality many cause mortality can increase. So the challenges that I feel to tackling these health risks, I think we often expect people, if we're talking about homeowners, to change their behaviour, but without the necessary supports. It's very hard to expect people to do so unless they're facilitated. I think that maybe we don't always agree what the issues are. If you're listening to the radio any day of the week, you'll hear adversarial discussions about the issues that affect us rather than collaborative discussion and agreeing on what the issues are in the first place. We all operate in silos. We're all working in different agencies as well. So it's, we don't always have our plans aligned in our programmes. And we don't have integrated planning or working together even. And prioritisation isn't always in place for the important things. And we don't necessarily invest in what's most important as well. And then I think also we can have inertia in our planning in which we have set positions and we're afraid of changing around in case investments that we've previously used are going to turn out to be, left, that wasted. So the solutions I think we do need these are very general ones really first. I think we need to have public discourse and we need to be about what's important to the public. And we're here for the benefit of the public. And I just mentioned about public health there. We're trying to, and all of us are trying to prevent disease and prolong life and so on. But a lot of it is to the organised efforts of society. And a lot of the way, so I think we need to work together and organise ourselves towards achieving good public health. So we need to make sure that all our policies are aligned with the values and goals that the public actually have, what's most important to them. I think there are a few things like health impact assessment and health in all policies that the World Health Organization recommend, and we're not really implementing them at all, so we don't really do integrated actions. We're all operating hopefully close enough together and we all know each other, but we're actually working off different plans and we're not working to the same plan really. And I think we can provide comprehensive public information when we all work together and all the information is sort of integrated. And so we can, work towards really important goals for us all. I suppose the sort of public information that public health would be giving out, say, for heat waves, this is more specific really, would monitoring indoor temperatures, ensuring access to cool spaces and so on, drinking fluids, not relying on fans if the temperature is too high. It's also a risk for infectious disease spread. Other types of technology, energy efficient technologies. And of course, we need to be aware of heat islands, urban heat islands, and maybe what we can do to reduce heat, like traffic changes and so on. And reducing or increasing albedo, which is the reflecting from buildings, restricting living on top floors. That's what they learned in Europe in 2003, and so on. Public information for air pollution, I think Patrick was mentioning it there, was to, I suppose we need to obviously reduce the pollution through the transport, active travel and clean fuels, but also what we use in our houses to heat them. We need to raise public awareness and what they can do and who are the most vulnerable groups. We need to make sure that people know about the Air Quality Index for Health so that they can actually use it, because it's really good quality information, but it's making sure that people know about it. And I suppose from a public health perspective, we do public health risk assessments during incidents and provide advice. We need to maybe do more of that. So I think making sustainable and safe choices easier are about things like looking at what's going well and what do we need to do better. And we need to be looking at what are effective win-win solutions where people invest in something and they get more than just one benefit from it, or there's no adverse impact for them. Investment, I think we need help from, for homes, we need help from externally. And I think Francesca was talking about getting grants and things. It's very, very important. People can't really do it by themselves. And then maybe that we have coordinated communication as well. So my key points are, we have heat waves and air pollution are serious health risks. And we need to have integrated planning and coordinated implementation, maybe working together maybe more effectively if we can. And we need to evaluate what is working and what can we do better with. And I think from just a general perspective, it's designing and adapting our houses and urban areas to keep them cool in heat waves, which obviously requires, a lot of different disciplines involved. We need to make sure there are cool havens. Like, I know in hot countries, they often have like malls and places where people can go during hot weather so they can keep cool. We need to move from air polluting fuels to clean fuels, obviously, and ensure that the vulnerable groups are aware how they can protect themselves from air pollution. So that's it, and thank you very much for all your attention, and I hope it fitted in with the other presentations as well. Thanks.
Thank you.